on. Okay, now we're good. Okay, so this is our group discussion question for the cigarette DQ. So our introduction is our group completely agrees with the statement that the laws of supply and demand indicate that higher prices are ineffective in reducing smoking, while the laws of supply and demand suggest that higher prices can lead to reduction in demand. Evidence from numerous studies indicates that higher cigarette prices are indeed ineffective in reducing smoking rates. Research consistently demonstrates that raising cigarette prices through increased taxes can be somewhat effective in tobacco control policy and smoking, particularly among the vulnerable populations such as youth, young adults, and individuals of low socioeconomic status. These findings highlight the importance of implementing tobacco taxation as a key policy measure to combat smoking and promote public health. And am I doing the elasticity of demand too? Yeah. Okay. So the next we have the elasticity of demand. So here in this condition, the elasticity of demand is inelastic, or we can say that the demand for cigarettes are inelastic for people to buy the cigarettes, even when prices are high. Um, we can explain this statement with an example according to, the Center for Disease and Prevention in U.S. in 2021, approximately 11.5% or 28.3 million U.S. adults currently smoke cigarettes at the current prices, and according to the reports, the numbers are going to increase more.
Okay, thank you, Raymond. You explained very well. So today I'm going to explain about the level of income, how it affects the cigarettes of the person. So the impact of rising smoking prices is also affected by the socio-economic levels of the people. Higher the income, the percentage is less as compared to the low income people. So here we get to know only percentage of income spent in cigarettes. Are the brands are different, otherwise the habitual person don't get affected by anything like increase in prices or increase in taxes, whatever it is. So here is the data of spending income percentage on the cigarettes like the CDS United States. So by annual household income which is spent by the people, like the low income people, they spend around 18.3% of their income on the cigarettes, and the middle income person, they spend their 12.3% on the cigarettes, and the high level income people, they spend their 6.7%. So here is an example about, like, here in USA, low income people have the EBT cards provided by the government. So every month they get the fixed amount of money in the card for the grocery. However, they spend their EBT card money on grocery, because this card cannot be used for tobacco products or the liquor. Now these people buy the cigarettes from their income, so they might using more percentage of their income in buying cigarette. So the above data is an estimate, we can say that, but reality is much more different. So the Burman, she gonna conclude it. Over to you. Thank you.
Yeah, thank you so much. So if we take a look on the inelastic demand curve, we can see that in case of necessity goods, habitual products like cigarettes, don't really depend on the price change or taxes, and it barely affects their consumption. If we're talking about the taxes imposed by the government on tobacco products, producers used to transfer it on the consumers. So in this case, the consumers have to pay the most of the tax and still demand the cigarettes, and it doesn't change. In this case, consumers burden on let's say necessity good, it's higher than the producer burden, sorry. And overall, at the end of our statements, we can add that one more point about the illegal market where laymen get the tobacco products without tax. So this is one of the reasons also which contributes to the to this effect, let's say, when less people are affected by the high prices. And there are so many loopers which needed to be controlled by the government, as we also talked in the introduction of our topic. And that's it for today. Thank you.
Okay, thank you, everyone. Okay.